Thank you everyone for coming today and attending, not coming, but attending this presentation. I'm gonna present today a multi-objective stochastic model for interdependent resource allocation during the response to the COVID-19 pandemic. I'm Hussain Abualkhair, I'm a PhD candidate. I'm working on this research, and I'm working actually on my PhD under Dr. Lauren Davis. She's with us here today. And we have also Dr. Fanda. She's from Kadir Has University from Turkey. She's joining us in this research as well. First, I'll start here with the introduction. I'll give a very quick literature review. I'll talk about the methodology, research questions, and sample results, and then I'll finish with the remaining work. So everyone living now, we all living in this pandemic right now, COVID-19. It's a very difficult time for all of us. We're all trying to go through this pandemic and be safe as much as we can. The pandemic started on April. Yeah, I can't see my notes here, but it's okay. It started in November, actually, end of November 2019 in China, and until today, we have huge numbers. It's a very rare disasters that we can see. So around the world, we have about 16 million total cases. Those numbers as of just yesterday. We have total death of 665,000. 3.9% of those people who got affected or who got the virus, or 39% they died, they passed away. So active cases as of yesterday was 5,700,000. In the US only, total cases is about 1.33% of the US population. Total death is 3.4% of those people who got positive test results for the COVID-19 or convert cases. Active cases as of yesterday, we have 2.1 million. So we all asking when it will be over. I don't know. It's not that no one can answer this question. No one can know exactly where is it. We have a lot of predictions, and many people, they predicted some dates and some dates that we're gonna finish this pandemic or this virus. But until now, we're still fighting, and we will keep fighting until we finish. Disaster operation management. Disaster operation management, this field where this is my field actually of research. So I'm working on disaster operation management. We were working on hurricanes, tornadoes. We resource allocation through when we have hurricanes and tornadoes, earthquake, all these natural disasters or human-made disasters. But this one is totally different. It's the 21st century disaster. Until now, we can pass this disaster and recover from that disaster. But we're doing our best. We will pass it, as I mentioned. But the difference now between the other disaster and this one, on the other disaster, we have a lot of researches. We have a lot of papers on the mitigation, on the preparation, and the response. But this disaster just hit us, and it's keep hitting us. It's not like the other disaster where you got hit once and then you try to recover, or you respond to that hit and then you try to recover. This one is totally different. It's working. So I think what we need from in this field now, we need to focus on the mitigation and preparation, and even the response, how we do all these, even the recovery. Those are four phases for the disaster operation management. We need now to remodel and re-understand those four phases for such a disaster or pandemic like what we have now in COVID-19. Global challenges. We have a lot of global challenges with the COVID-19. It's hit the healthcare systems very hard. It hits the education system, the trades, international trades. the unemployment, and many other challenges that we have here. So our focus on this research will be on the healthcare systems. We chose the healthcare system because it was the first responders for the COVID-19 now. So we focused on the healthcare system, and then we see where is the problems there, what challenges that we have here in this healthcare system. So we found that they have some resources shortages, such as medical staff. They have medical supplies such as ventilators, face masks, gloves, beds. The hospital capacity were not enough. They need more capacity. They need a lot of things to improve, or to be capable to defend human from this COVID-19. So we were focusing on those two, the medical staff and medical supplies, the shortages of those two for the hospitals. And we will focus more on some cases that New York has done, because we focused in New York because New York was the most states that hit by the coronavirus in the United States. And if it's not the most states in the world, like it has the biggest number all the time. So we were focusing in New York, and many of us, if not all, were seeing Governor Cuomo, his everyday conferences and follow-up meetings with the media. So we can see what they did, how they predicted the demands, what they were expecting, and what do they need. All this information, all these data, we keep tracking those and see what's going on there, so we can model some good research, or make a very good research that we can compare it with the reality. In New York, the biggest problem that they had was with ventilator, and we see Governor Cuomo all the time saying ventilators, ventilators, ventilators. We don't have ventilators. We asked the federal government for ventilators, and all that was on the beginning of the pandemic. But now they have like good numbers of ventilators there, because they start manufacturing and they start getting more from the suppliers and other things. The other stuff was medical stuff. They asked for medical staff, and they asked for beds, they asked for all these things. So but those all together, like, it's gonna serve a number of patients. So we're gonna see how that problem is going on there. The first thing is ventilators. The adopted way to cover the ventilator shortage in New York, it was federal government request ventilators from the federal government. They requested about 15,000, and they just received 4,500, and that was on the beginning of April and end of March once it started. They ordered from several suppliers, purchased 17,000, and they only received 2,500. They asked for donation. They received 1,000 from Alibaba. They received 140 from the state of the Oregon. And finally, they seized 20%. And it's not seized as like Governor Cuomo always say, it's not seized, but it's sharing. They share, the hospitals start sharing. So, but here in the modeling, we call it seized because we use it a lot on the simulation models and in all these things. So we're seizing 20% of unused and available stockpile from upstate and Western New York hospitals. So he's taking it from there and put them down downstate. So he received from the 20%, he received 500 ventilator. The other problem was medical staff. They have lack of medical workforce. They ask for volunteers. So as of mid-April, he asked for 90,000 medical professional. They assigned for volunteering. They signed up for volunteering. 25,000 were from outside of New York. Around 12,000 were referred to hospitals, and the other they were not. So they asked for a lot, but on the same time, the expected number that they need was about 45,000. So only 12,000 were referred to the hospitals, and there is a lack also there on the processing. So how they approving those volunteers, because it's a medical, it's not something else that we can just train people and they do it. So it's medical volunteering, so they need some of, most of them, all of them, they need license and they need to work there. So but they give some exceptions, but it wasn't, I don't remember exactly about what, but they gave some exceptions for yes, I remember they gave exceptions for the volunteers from out of the states who doesn't have the state license, a medical license, but they have other licenses. So what is the current allocation sorry, what is the current allocation process? New York government allocating resources from low hit spot to hot spot. This is what they're doing, and they keep doing that as they observing and monitoring the demand, the predicted demand. So the problem context, I have some small toy here just to explain it very, I'm trying to explain it very easily. It's not that small network, but it's a big network. I just give an example here of 3 hospitals. We have H1, H2, H3. Those are 3 hospitals. Each hospital has 3 phases are patients. So we have we have patients for hospital 1, hospital 2, and hospital 3. The demand is different for each one. The small boxes here, or the squares, is for ventilators. Hospital 1 has about 5, hospital 2 has 4, and hospital 3 has many ventilators and they have less demand. What we have there, we have also the state stockpile for the ventilator. The stockpile, they send ventilators as they predict the demand for each hospital. Also, in the same time, this is what they did there. When they seized the 20%, they took it from the hospital and they keep moving these ventilators in addition to the ventilators that the state sent. So they send all those and they reallocate it between the hospitals. So the hospital receiving from 2 sources. The first one is state stockpile, and the second one from the other hospitals. On the other hand, the same hospitals, we have the same 3 hospitals right here. Let me change, this is laser pointer. So we say we have the same 3 hospitals right here and the same network, but we have an interdependencies there, but I'll show you. Before that, we have those here volunteers, they come also to those hospitals. They have some volunteers and some co-workers, and then we have the registered volunteer. Those registered volunteer who registered online and they are approved, so they are ready to be assigned. Those, they will be assigned from different locations, but we assume here they are in one location, such as and one, we just do it that way to get the cost would be the same for the transportation for those volunteers. And we could later is study the out of state and the in state, and we give different costs for those. But for now, we're just doing the same assumptions for all of them. The interdependencies right here, if we see, this is the first line. So when we send ventilators to the first hospital here, okay, we can, it's the assignment of these volunteers will depend on the number that assigned to that hospital. So, or the available number of ventilator in that hospital. So we don't want to send more volunteers and they stay there without work. We are assuming that it's one package. So if we send ventilator, we need to send one volunteer. And this is what's happening even in the real world, when they have to give a package for a patient. They get the bed, ventilator, and worker. So they need all these 3 to serve one patient. So the assignment of volunteer here depends on the assignment of ventilators, and this is what we did there for all of them. The other problem that we have here that make this problem more complex, that we have random arrival of ventilators and random arrival of volunteers. They arrive randomly, and as well as we have random demand arrival. So demand arrive to each hospital randomly. So there is a stochastic process in this model, because that we mentioned on the beginning, we have a stochastic, um, multi-objective stochastic model. The multi-objective, we will discuss it on the following slides. Literature review here, we have done some literature review, but as this case is very, very like we're living now, we just have one study. I'll show it to you on the, and at the end, that study we're focusing on assigning ventilators, but it was between the whole states, and it doesn't have interdependent resources for that for ventilators. So we were just focusing on ventilators. We have here, we were focusing on disaster operation management, the pre-disaster, post-disasters. Forget about the other numbers there. We have the problems, the resource allocations. This is what we were focusing on. They were personal and material. We were focusing here on both of them. The other thing, we have methodology. The methodology, most of the researchers, they were doing mathematical instead of simulation. We're doing it also mathematical here, but on the final, on the like extension, we will add also simulation to see how this model will work and compare it to the optimal solutions. Finally, here, the spontaneous volunteer and queuing behavior. Those two things that we have done before, like it was my work that we have done, it was about spontaneous volunteer and queuing behaviors. It was resource allocation, DOM, disaster operation management, but it wasn't in such a disaster like this one. And we were only focusing on assigning spontaneous volunteer, but here we are assigning volunteers in addition to material, which is the ventilator, and they are interdependent on each other. We were studying interdependencies there and some other things, but this is another problem that really interesting that we're working on right now. This is the study that I just mentioned. It's there now. It's for Mihrota. They're studying the resource allocation, resource sharing for ventilators between the whole states. The methodology that we're here, from the model, we're looking for develop a multi-stage, multi-objective, stochastic optimization model to find the optimal allocation for two interdependent resources in order to respond to a similar pandemic as COVID-19 in future. So maybe now it's not like we can implement this one right now. Hopefully we are at the end, but if not, if we still need it, it's gonna be a very good framework to start from there and keep tracking and doing what we have now. The two resources that we're focusing on here, as we mentioned, it was ventilator and volunteers. The model will focus on satisfying the demand while reducing the inequity of allocated resources. So why we're focusing on inequity here? Because this was like most governors in the states, they were not most, but Governor Cuomo, for example, he was like upset why it's not like the distribution on the beginning. We need more ventilators than the others. The virus hit us more than the others, so give us the ventilators. He asked also the other states to share ventilators. So inequity here is very important. We need to give the right portion for each hospitals that serve their demand, and we need to be fair here. Model assumptions, those are the state of this, sorry, it's not the state of the system, that was by mistake here. The assumption, it started from here. We don't need this one. So demand is the number of patients in each county. Demand is uncertain for each county. Two heterogeneous resources are considered, as we mentioned, volunteer and ventilators. Each volunteer here will serve 3 patients. We are assuming each volunteer will serve 3 patients, and each ventilator will serve 1 patient, and we will extend it to 2, as they did on some of the hospitals. They'll try to split to serve more patients. Except volunteers, all other supplies and beds are enough for all patients. Doctors and nurses, volunteers are considered homogeneous. They both consider volunteer. And then we have here the model formulation. In the model formulation, I haven't bought the notations and all these things because we always like in inform presentation we have 20 minutes, but I saw here like we spend more time, but I don't want to take you a lot to, it's a lot of formulas and notations. So I'll keep it very simple and I'll take you over each part and each constraint, just explain what's going on there without telling what's like, you don't need to know the whole, it's just an overview and compare it to the reality. So the first one here, the model objective is to minimize deviation from target. So this is the first objective we have is minimize deviation from target. We don't want to send more volunteers or more resources than needed, and we don't want to send less resources than they need. So we try to minimize these deviations from the target or the demand. The target here, you're going to hear me a lot saying target and sometimes demand. So the target is built from the demand. I'll show you in the next slides how it's calculated. So the second objective function, we have inequity between hospitals. We're trying to send, as I mentioned, we try to make fair distribution. The third one is idle assigned resources. We don't want to send us volunteers or resources and they stay idle there. So we want to minimize their being idle there, because they could serve other hospitals and they could serve other locations. So they might be needed there more than in here. So the fourth one was transportation cost. The first part of that here is the assigning from hospital to hospitals, and the Y from what we have in hand for the state. Let's consider both of them, the volunteer and ventilator, are in stockpile. Volunteer can be in stockpile for sure, but we just assume those who approved, who registered to volunteer and they are approved, let's assume that they both on stockpile, so they have transportation cost for both of them, or it could be also a hiring cost for those. So those costs, we will manipulate them, but there is a cost to hire those or to transfer those volunteers and ventilators. The first constraint we have here is the supply constraint for the supply constraint. Okay, for the supply constraint, as we mentioned, have we mentioned that? No, we haven't mentioned it. So here we make it, the first one, what we will transfer is what we have received on the first period or the 2 periods before that for volunteers. So for example, if we have volunteer, okay, and we send volunteer and our decision epoch, for example, is 3 days, okay, so or every day, we can't make volunteers transferred every day from hospital to another, okay, so there is a time we need to make sure that they sit there at least a week, for example. So if we keep them a week here, so pi here would be a week, so 7 days, for example, if we're doing days. And even and for and each of the resources has different number, so this is what it's going to be there. So we assign based on every day or the number of days. Sorry. The second one, supply constraint for Y shouldn't be exceeded what we have on hand in the beginning or what we have available in the stockpile, so they can't send more than that. The remaining supply in the central warehouse, we calculate the remaining supply in the central warehouse. It's based on what we have and what we received on the previous, what we have on the previous period and what we have. No, sorry. It's like the ending, calculating what's remaining in our in-hand inventory on the stockpile, for example. The fourth one is the available resources in hand for each county. It's very simple here. It's like the inventory that we have. It's like the inventory problem. We have the current inventory, or the current resources on hand is what we have on the previous period, minus what we have transferred in this period, plus what we have received on the previous period. So now we go to the deviation from target. All the first, that slide was about like just to start the model. And now here we see how those objectives will work. So those constraints now I will show those related to the objectives. So the first one here is the minimizing, is to calculate the deviation from the target. And we do it here as a goal programming. The under target is U minus the over target equal the target. R is the target. How did we calculate the target? We got the target from the demand for each county or each hospital. So you hear me sometimes saying county, it's county, I mean with county hospitals, but because we were doing it as counties, but now it should be hospitals, not county. So here's the target equal the demand divided by M. M is the number of patients that can be served by one resource. If you remember on the assumption, we say volunteer will serve 3 patients, while ventilator will serve 1 patient. The second constraint, so the first one here is satisfy the first 2 objectives, the one that minimize the inequity, and the other one minimize the over target, because both of them, they have for the first objective, this one now. It could be used for the second objective, because U is what is the target minus U here. The under target is the target minus what we have on hand. So this could be U as well. So the under target is used for both first objective and second objective. Here we go for the inequity constraint. We calculated the inequity constraint. We got the maximum value and the maximum, then the minimum, and then we got the difference between those on the second objective. Then the third one here, we talked about, we introduced the interdependency. In the interdependency here, how did we build it? We built it based on the number of patients that will be served. So for example, hospital one, they have 3 patients. They have 3 volunteers. So the number of patients that will be served by those 3 volunteers would be 9, because each volunteer will serve 3. So the number that we'll have will be 9. And on the second part here, ventilators, if we have 2 ventilators, okay, so it's gonna be, if we have 2 ventilators, it's gonna serve only 2 patients. So we don't need to send all 9 or all 3 all 3 volunteers there. We could just send 2, or even 1. No, we need 2, because the ventilator will serve 2 patients. So we need 2 or 1 volunteer here. So we need 1 volunteer to serve 3 patients. So they have 1 more exceed work that they can do. So we're trying always to minimize these exceed work. This is very small numbers I gave, but if we got some bigger numbers, it would be different. And this is related to the third objective. Research question. Those research questions, we just like, we might manipulate those, we might change them, we might delete some and add some more, but I'll show you what we have right now, and I would be really happy like to have all your comments, all questions. It's gonna improve this research, because we're still working on it. It's not finished yet, and it's need a little bit more work. So the first research question that we have is, to what extent the demand can be satisfied when the assignment of volunteers depend on the assignment of ventilators? So here we will examine the interdependent model versus the independent model. So if there's an dependencies, because we could send all of them without making any dependencies. So they just send volunteers along, they keep them there. So they're gonna stay without work because they don't have the ventilator. They could use them on some other tasks, maybe. So we will compare those 2 models and find what will happen with those. The second research question is, to what extent does the optimal solution change when hospitals increase the safety stock for ventilators? If you remember, we mentioned that they're seizing 20% of the unused ventilators in hospitals. So what will happen if we take more than that or less than that? Because what you're gonna take from them, they're gonna need it one time later, like later. So that hospital who gave you these ventilators, they're gonna need them later if the virus hit them or the pandemic hit them. So we need to examine what's the best safety stock, and was it 20% is the right number, or we could increase it, decrease it, how it's gonna affect the model. The third research question is, how many ventilators the state should keep in stockpile? Safety stock for state inventory. So we were looking for the safety stock for the state inventory to use during the pandemic epic. So this is what they're doing. Even in reality, they're keeping some ventilator on stockpile and they keep it there. So even they ask for numbers, they ask for more than what they need, because they were expecting they're gonna be hit more. So we will study these things and we will compare it to reality. We will see if that what they're really doing or not, and how can we compare it later. So research question 4, to what extent does the optimal solution perform when the decision maker increase the time period for each medical staff at each county before they are allocated? This is what I just mentioned before on the model. So we don't want to allocate them every day. It's very hard. It's very hard to allocate them every day or every 2 days, 3 days. It's still very hard, because once they go to hospitals, sometimes hospitals they need like to give them a tour on the hospital. They know what's going on in the hospital, their policies. Some of them they give training and these things. So we're not assuming these things here, but we are assuming that they can't stay there for 1 day or 2 days. They need to stay for a long time, and we will find what's the best optimal time for them to stay in a hospital before they are assigned again. The results we haven't come up there a lot. Well, we have like some sample. I got some sample results of what we have on the model, and they started with the single period model. On the single period, here we have like demand. We have two demand for hospital 1, hospital 2. We have hospital 2 has higher demand than hospital 1. So the stockpile that we have in hand is 300 volunteer, and we have only 50 ventilators. Okay, but each hospital still they have some ventilators and some volunteers that they're working there. So we assume that hospital 1 they have 50 ventilators, and hospital 2 they have 50 ventilators. Volunteer in hospital 1 are 20, and volunteer in hospital 2 are 20. So from that, if we see these numbers, this demand, we have 120, we're gonna say just keep each 50 there. Someone could assign them that way. Someone else will say, okay, they have 50-50, and we have 50 ventilators. So it could be fair to send 25 more to here and 25 here. It could, no, some people will say no, if you send 25 here, 25 here, it's still not fair, because those have higher demand than the others. So we need to get a ratio here. So that what we did on our model, we didn't assign them just to be there, but we assigned them based on the number of the demand comparing to the other demand. So if we see this, the results here, we have the target here is calculated based on the demand. So hospital 1 was 100 divided by 3 will give us this. So the target for volunteer at hospital 1 is 33. The target for volunteer at hospital 2 is 66. And the target for ventilator hospital 1, ventilator hospital 2 are 100 and 200, because the ventilator will serve only one patient. So the target would be equal to the demand here for those resources. If we now see here the available resources, the resource transfer, the model transferred here from resource 1 to transferred 11, and from resource 2, they transferred 25 to hospital 2. And then here they received those numbers. If we see here the total received would be this number. So the total received, or the total the received plus the one that they have. So the total would be 9 volunteers here on hospital 1, 42 on hospital 2, 25 ventilators on hospital 1, and 25 for hospital. These the will be here. If we see the under target, this is what we will focus more on the results, and even on the other results we will focus more on these things. The under target here were 24.33, 24.66. They were very close to each other. And if we see here on hospital, on the ventilator, hospital 1 and hospital 2, they have the same number of under target. So the model tried to make those numbers equal. Because of that, they just make it, they took the 25 from resource 1, they had 50 before, they took the 25, they put it there, and they give all 50 to resource to county 2. So the total was 125 to make it here fair. Okay, so the idle volunteer, they haven't used anything there. So why they didn't took we have under target, but they didn't use volunteer here. So someone would be asking why? Because as I mentioned here, we have interdependencies on the assignment. So we calculate the number of available volunteers. So if we come here, calculate the total received, the total in state, for example, it's not received, but the total in state, it's gonna be 9. Those 9 will, each one of them will serve 3. So we will have here about 27. So we'll have 27 patients here, and here only 25. So we need only volunteers that can serve 25. So 9 would be the best number to send there, or to have there in that state. The weights that we used, as we mentioned, we're using a multi-objective. So since we have a multi-objective, we need to use weights. It's not only weights, but it's also, since we have different units for each objective. For example, the last objective calculate cost based on transportation, maybe miles. The first objective cost based on under target and over target. The other two, objective 2 and 3, were about differences between maximum and minimum. So it's different, all of them, they were different units. So what we have used there, we did scaling for those, and then after that we did sensitivity analysis for the weights to get the right weights that works with us. So if here and in reality, so the first objective is the most important, is to reduce the under and over capacity. The second objective is also important. So because of that, it got the second higher rate. The third, it's not very important, but it's still more important than the fourth, because transportation cost, it's not always important in these humanitarian logistics, because saving life is more important than spending money. Here, when we see this one, this is the same table that we have here, okay, with those weights. I'll show you here what will happen if we just get the first weight. So we just get the first objective. So we give the other objective 0 weight. We don't have them. We don't want them. Okay. So what will happen here? Do you remember our idle there? They were 300 on the first model, but now they are 239. And we had under target for the volunteers at each hospital, but now we have them zeros here. So this is the difference taking place because we removed the objective for the inequity. So it works now. It sends everyone to the satisfy the demand, and satisfies the demand and doesn't want to go more than that, because we're going to have more cost for the over target. On the second time here, we did for the objective 2, only objective 2. If we see objective 2 only, okay, objective 2 is for the inequity. So there, it gave us the same results here, but it used from the central warehouse. It didn't look about the other cost or about any other things. It just sent from the central warehouse. And on the same time here, will not, sometimes it will not work with some numbers. It should be, it should be works with the under target, so it minimized the under target more important than this one. Yeah, here if you see it, it's missed the transfer. It was different, many differences here, and that. So here those sorry, this slide we have here now objective 3 and objective 4. Okay, objective 3, that we don't have the idle volunteer. We still like, if we don't have that one, we didn't care about the target, if we satisfy that one or not, because we removed all the objective. So targeted here, targets here, and under, they all under target, it doesn't matter, they just want the model will not work effectively actually here. So the fourth one, only objective 4, the objective function for those two actually is 0, because there is no costs. Here, we will not transfer any volunteers or any resources from county to county, or even from the warehouse. We just keep what we have there, and we got this under target. So if we go back to the first one, we found that the first one give us the best solutions that we want, and I'll compare it here with the multi-period, sorry. On the multi-period, sorry, I just want to, okay. On the multi-period here, I'll go very quick on the multi-period. What we have done here, it's the same data, but we changed the first time period demand is the same, but the others were different, and we manipulate on those. We could change them and do all these sensitivity analysis and all these assumptions and scenarios. So, but here I just want to compare the first period. I'll show you very quick because the time. So I'll compare the first two periods. You're gonna see here, the under target here is minimized 0.33, while here it's not. So the second objective, we're not working very effective here. But if we think about it, why we're gonna that happened because they're trying to satisfy the other periods. And in this model, once we assign a volunteer, we will not assign him until period 3. So if it's a volunteer assigned on period 1, the next assignment will be in period 3 if we assume that we assign based on weekly demand, for example. But here on this one, it's gonna assign every period. The ventilators will be assigned every period. Remaining work, what we have to add safety stock for each hospital and state warehouse. We will examine the model with larger data, real data. We're gonna see what will happen. We add stochastic demand. We add stochastic resource arrival, and study the hospital's coordination. This one of the things that we're thinking about now, and if the time didn't serve us, we might do it on future work, but we have it until now in mind to work on those. We need to see how the private hospitals and public hospitals, they were coordinating with each other, or with the government and with the state, and we see how this coordination can affect the model, if they have coordination, if they are coordinating or not. Finally, thank you very much, and I'm really sorry I took that long time. My research, my PhD is supported by Saudi Arabian Culture Mission to the US and Taif University. Thank you, everyone. I hope everyone to be safe with this pandemic. Thank you. And thank you for University of Oklahoma. Sorry, doctor. Thank you.
Yeah.
Thank you for the chapter there. They did a really good job. Thank you.
Yeah, thank you. I think this highlights that IEs have a really big role to play in planning for a variety of areas dealing with the pandemic, and we're seeing that with several calls for papers that are coming out, for methods and theory and application associated with COVID-19.
Right.
So we've been going for about 45 minutes now. I don't imagine there's going to be many. Does anyone have maybe a quick question to ask for Hussain? Okay, then. Well, Hussein, thanks so much. And we've got one more presentation next week from the University of Arkansas. And so we'll see you next Wednesday.
Thank you very much.
See ya.
See you. Bye bye.